So she doesn't know that, and then I'm gonna ask her again. Do you know the name of the hospital that you're in?
Yeah, it's over there.
Okay, so that's A0 times 2 because she knew 2 of the 3. That's pretty much it. When you're doing your quick assess, she's probably gonna be A0 times 3. She's gonna know all of them. We're not gonna make it difficult for you.
Times 4.
They're only doing 3 here. So remember when I taught you guys, it's different for each hospital. Some might do 3, some might do 4, depending on protocol. After that, I'm literally going. I know we taught you different orders, but I'm going to go down head to toe, so it's a lot easier. It's a lot more fluid. I'm going to start with her head. So kind of what you guys just learned right now, I'm just going to inspect, look at her palpebral fissures, making sure they're symmetrical. Looking at her nasolabial folds, and it tells you too, the palpebral fissures and nasolabial folds are symmetrical. So it tells you what to say and how to say it. You're going to look for periorbital edema, so swelling around her eyes. You're going to look for facial drooping, sign of a stroke or other symptoms. You're also going to, you're going to verbalize and say cranial nerve 7, facial is intact. That's something that you're going to have to know. Other than that, that's it for the face. You're not using a cotton swab on her face for this, so it's a lot simplified, and you're not doing as much as you learned. Next, you're going to look at the pupils. So I'll bust out my pen light. Does someone have a pen light at the bottom?
Oh, shit.
By chance?
Yeah,
I'm going to show you this real quick. I know we just learned it, but you're going to do the Perla, what you just learned. So I'm going to start by shining it both sides. And then I can already see the corneal light reflex. It's symmetrical on both pupils. And I want you to verbalize pupils are equal, round, react to light, and accommodate. The corneal light reflex is symmetrical. And then I'm also going to do the cardinal gazes. So I'm going to do the cardinal gazes, and I'm going to verbalize and say cranial nerve 3, oculomotor is intact. After that, I'm going into stuff that you'll learn, I think, on Wednesday. But you're going to inspect her mouth, mucosa, and her lips. So I'm going to have her open her mouth for me. And I'm going to shine a light in there. Make sure you actually look. Don't just do it super quick. So look inside. Look at her lips. Make sure that they're pink and moist. There's no lesions. I mean, she's not going to have lesions. Your partner probably isn't going to have lesions. So just follow off this script. You're going to assess her tongue. So I'm also going to have her open her mouth again. Stick your tongue out for me. Oh, you did it. And move it side to side. So that's testing the hypoglossal nerve. So that's nerve 12. I'm making sure it's intact. It's not like, it's midline and it's not shaking when she puts it out. After that, you're going down to her neck. So I'm literally working my way down her body. You're going to inspect for JVD and to make sure the trachea is midline. That's pretty much all you're checking for on the neck. So, like you just learned, we'll do JVD. Go look that way for me. Shine your light. Take the pillow out. Make sure that their head is elevated. She's already elevated, so I don't have to do anything. Look towards me. Check both sides. And then for her trachea, you can just feel like you just learned. After that, you're going to. Now, I don't care which order you do it in. Just make sure you do it. On here, it says upper extremities first. You can do her chest and her lungs first if you want. I'm going to go to her chest and her lungs first. So I'm going to skip down to chest. What you're going to have to do is take the gown. Can I remove the gown? Like, okay. So I'm going to drape it down. And if you're with a female patient, again, you can do it just like that. So you're not exposing your patient all the way. On here, I want you to inspect first. So what I'm checking for is a regular rate and rhythm of her breathing patterns. I'm not seeing any retractions, and I want you guys to verbalize this too. It's in there what it says. No nasal retractions, no subclavian retractions, nothing. I also want you guys to verbalize there's no accessory muscles, and the AP diameter, it's 1 to 2. It's in there. And then that's about it for respiratory when you're observing. Something to keep in mind too, don't tell me that there's no retractions and you're not actually looking. You didn't remove the gown. I've seen it before where the gown has been still on, so you can't tell if there's retraction or not if you can't see their skin. Take the gown off, remove the gown. After that, I want you guys to listen. Do you guys want me to do it for you? Or do you want to actually listen for you guys? Yeah. Can we do it? Okay. So, we're going to do anterior and posterior for the head to toe. So I'm going to start. And then you just do 6 to 8 places. So I'm literally working my way down. And tell your patient to, every time I place my stethoscope down, take a deep breath for me and down exhale. And now I'm also going to go lower, so one here and one here. And then what you can do from there is you can do posterior side too. So I'd have her sit up. Want to sit up for me? Okay. And then you can listen to the back. Maybe can you sit off the edge? Just you turn your legs. Or yeah. Just, if you guys want to come around, you can see where I'm actually putting the stethoscope. Did I skip something or is that cool? Okay. And then what you're gonna start is you're gonna listen. Start about like right here. Have her take it inhale and exhale for me. And I want you guys to work your way around the scapula. Like I said, I'll probably take points off if you're right here and you're saying you hear clear breath sounds. I'm sure you're not hearing anything. And after you do those, I want to see. I mean, it doesn't really matter how many spots, but I really want you guys to see you guys work your way around. So shoot for about 8 spots down her scapula, and then you're also gonna hit 2 on each side right here, so you can have her lift her arm up. And do you mind if I move this a little bit? What I do is I'll put like 1 here, and then I'll move it forward a little bit and put 1 in there too.
Nice.
Don't go over the bra like I just did or over the gown. Try to yeah. I'll show you. Don't lift your arm for me. Just hug yourself. So I'm not gonna go under, but what I do usually is like I put 1 right here, and then I'll go even more anteriorly and put 1 right here. That's okay, cool. Okay.
Yeah, I got it.
I'm not gonna move or make her move right now, but.
Are you supposed to check for tactile parameters and percuss?
So you're not doing it. I don't think you're doing that in your head to toe assessment. Yeah, it's not in here right now. So that's out. Literally, all you're doing is listening. Okay. So it makes it a lot easier for you. That's why you're able to do it within the 30 minutes that you guys have.
Yeah.
After that, that's pretty much it for lungs. Like you guys have that down. You're gonna also want to check for chest expansion. So this is a good time to do it too. So I'm gonna have her take a deep breath. I'm sorry if my hands are cold. And you're gonna wash your hands, kind of move symmetrically. After that, you can relax for me. Go ahead and lay down for me. And then you're gonna listen to heart sounds. I'm gonna want you guys to do the ape to man, and I want you guys to verbalize what is louder, S2 or S1. What's louder than that? So I'll make an example real quick. So I want you guys to actually find your sternal notch or the notch, and move down 1. I want to actually see you guys finding that placement. Put your stethoscope down, and let's just say, as an example, I would say aortic area, second intercostal space, right sternal border. S2 is louder than S1, and I want you guys to do that for each spot. Please listen before you actually say what you hear, just so it doesn't just seem like you're memorizing off the script.
Do you want us to check for the carotid at the same time?
Yeah, so do that too. Check to see if it's symmetrical with S1.
And then you check the carotid the whole time you're doing it.
It's not on here, but it would help me. It makes it look like you know what you're looking for. It's actually not on here, so. So for the heart, all you're doing is you're doing ape to man, and then you're going back up with the bell. When you're doing the bell, you don't have to verbalize anything, unless you hear like something that shouldn't be there. Then you can verbalize it. After that, you're gonna do the abdomen. So I'm gonna lay you flat all the way.
Doesn't feel flat.
It should be flat. I know. After this, so do you mind if I lift your gown up a little bit? Okay. So I want you guys to inspect first before you do anything. Inspect the symmetry. Let me see exactly what. So right here it says the abdomen is flat and symmetrical with aortic pulsation visualized in the epigastric area, left of midline. The umbilicus is midline and inverted. So literally just, you can read that what to say and you're just inspecting first. And then you're going to auscultate. Start in the right lower quadrant. Listen until you can hear ballot sounds. So I'm going to listen to each one. I'm going to move this down for a little bit. She's always got a hyperactive ballot, so I don't have to listen that long. She just ate my chips, so. So, what was that?
I think you hear it through yourself.
Yeah, so she's got hyperactive ballot sounds. I want you guys to, it doesn't say hyper or hypo, it just says ballot sounds are heard in all quadrants. It'd be better if you guys were able to verbalize if it's hyper or hypo or active. After that, you are going to have to percuss and you are going to have to lightly palpate. It says not to with abdominal pain. I'm probably not going to give you guys an abdominal pain loud parts, just I can see you guys palpate and everything. But you're going to start with percussion. So and after that, I want you guys to verbalize timpani is heard on percussion in all 4 quadrants. And then after that, I'm going to palpate softly. So you tell me if you feel any pain, okay? Okay. 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 And after that, you're going to say the abdomen is soft and non-tender on palpation. So that's going to be that. Since I'm on the abdomen, this is a good time to start with the bowel movements. And last time she skied, so I can ask her questions. When was the last bowel movement? And then was it soft? Was it firm? What was the consistency? It was perfect? What is that? I don't know that. Can you, is it soft?
It was normal.
Was it soft? Was it hard? Soft?
Yeah.
And that's normal for you?
Yeah.
She's like that. Okay. What was the color of it? Was it? Okay. And there was no blood? Okay. And then after that, I would ask her about her urinate when she last peed. So when did you last use the bathroom? When did you just urinate? What was the color of that? Is it usually that color? Was it like a lot of it? Was it a little bit?
It was not a lot.
And are you seeing is there any burning or anything with it? No odor to it? And no blood? You can pee more than usual or just sit no? Okay. So that pretty much knocks out bowel movement and the GIGU. And then now I'm going to do her upper extremities and lower extremities just to knock it all out. You can sit your patient up. Are you comfortable like that or do you want to sit up?
Yeah.
Okay. For the upper extremities that we haven't learned all of it yet. You did learn about skin integumentary, so I'm going to look at her skin. I'll make sure her skin's intact, there's no lesions, there's no scars. I'm going to look at temperature, so I'm going to use the back of my hand, and I'm going to feel down her arm. It's warm, temperature's even. I'm also looking at hair distribution, making sure that it's symmetrical and it's appropriate for her age, her ethnicity, her gender, everything like that. After this, I'm going to have her lift up her arms, so lift up her arms for me. And I can see the bottom of her elbows, checking for any scars or any pressure wounds that might be there. Other than that, for arms, that's going to be, for the inspection, that's pretty much it. And then you're also going to have them squeeze your hand. So I have to squeeze my fingers for me. This is assessing for grip strength. You can say 2+ symmetrical, strong grip strength. Let me see what else I have here. And then, you're going to check for radial pulses, cap refill. And I want you guys to actually verbalize this, so I'm going to feel both sides. Can you check your hands for me? Radial pulses are symmetrical and 2+, and then you're going to check cap refill. I only need you to do one finger. If they're wearing nail polish, don't push on the nail bed. So if she was wearing nail polish, I would squeeze her fingertips. Cap refill is less than 3 seconds, or you could say it's brisk. If it's not, it's sluggish. I want you to check both hands though. After that, that should be it for upper arms. You're going to move down to her feet. So I would roll, or she wouldn't be wearing pants, but I want to have these up so I can see her knees. I'm sorry, guys. I want to see her knees, all the way up to her knees, see if there's any scars, any bruises. Again, you're inspecting to make sure that the hair distribution is normal, it's appropriate for her gender, her age. And then you're looking for any swelling, any noticeable swelling before you even push down. But then I'll squat so you guys can see. But I'm going to be pushing, checking for edema. There's no edema present. You're also going to check for her feet strength that you haven't learned yet. I don't really want to push in the bottom of her feet, but go ahead, push against my hands, and then pull against my hands. So you're checking to see if both feet strengths are equal, they're symmetrical, they're strong. One's not weaker than the other. I'm also going to have you lay down for me, lay flat. Can you lift this leg for me? Just one leg, 5 seconds. This is another test for neuro. If she has a neuro deficit, she probably wouldn't be able to hold a certain leg for that long, and this one for me too. At the same time, I can hold it up and I can check the backside for any discoloration or any pressure ulcer that could be there. I'm checking this side too. Nothing. Again, she's not going to have shoes on, so I'll be checking her cap refill. Squeeze her toes, her toenails. I'm making sure that it's less than 3 seconds.